How to diagnose your runner's knee pain and finally fix it. So, how do you know if your knee pain is actually coming from your IT band, or is it your kneecap, or maybe even your back? But let me show you how to figure it out so you can finally treat the real problem. So, my name is Dr. Ray Peralta. I'm a physical therapist and certified run coach. I've helped hundreds of runners overcome knee pain and return to the sport they love over the past 10 years. I'm also trained in something called the McKenzie method, a system known for getting rapid pain relief in as little as 3 weeks by properly diagnosing the source of the pain, the root cause of the pain. And if you want my step by step method for getting back to running pain free, check out my free training video. That's in the link in the description. So in today's video, I'm going to walk you through how to identify what type of knee pain you're dealing with, so you stop wasting your time doing things like foam rolling or random stretches, stretching the wrong thing, and finally follow a plan that actually works, right? I'm going to break it down into 3 questions I ask every injured runner. So, right, starts with one, where's the pain? Like, what's the pain location? What's the pain behavior? What makes it worse? And then in the subcategory of pain behavior, what's the pattern of stiffness or weakness? Like, is it stiff? Is it weak? And any other symptoms they may be feeling. And then, well, let's go through this step by step. So, where's the pain located? Right? Pain in the front of the knee. Oftentimes, it could be patellofemoral pain syndrome. That's that pain. And if we look at a little diagram, what that looks like, right? That's just pain right in the front of the knee there. You can see that. Triggered by stairs, squats, or prolonged sitting. 70 to 90% of runners with this, it's a recurring pain or chronic issue. For example, I had a female runner with this who avoided stairs for months. But once we focused on hip and quad strengthening, she was running pain-free in just 4 weeks, right? She didn't have to keep doing random foam rolling and stuff like that. She just needed to properly strengthen the muscles around her knee and her hip, and she was back to pain-free running. And the thing with the knee is about 42% of all running injuries are coming from the knee. Then how about if your pain is on the outside of the knee, right? So we look at that diagram outside the knee, they call like lateral knee pain, right? It could be IT band syndrome. It feels like tightness or snapping on the outer knee. Most common in men and worsens with repetitive flexion, kind of when you're running, repetitive knee bending. I was working with a marathon runner who thought it was just muscular tightness, like, oh, I just got to stretch out my IT band. I got to do IT band stretches. But it was actually compression on the fat pad underneath the IT band. And once we corrected this, his tried and added like hip strengthening work and actually stretched out the TFL, the muscle that attaches to the IT band at the hip, the pain was gone in 3 weeks, right? It wasn't just about doing some random IT band stretches, but actually addressing the tissues above the IT band. In this case, it was at the hip with the glute work. How about pain on the inside of the knee? That might be a medial meniscus or MCL strain associated with twisting, right? So twisting forces, maybe you're cutting and pivoting on your runs or on trails, or with squatting movements where a lot of deep knee bends. And then you may feel pain with that. You may feel clicking, catching, or locking at the knee joint, or even some swelling around there. I myself dealt with meniscus injury. Initially I thought, oh, I just have to rest, but resting alone didn't make it go away, because the minute I would ramp up my activity again, it'd make the pain temporarily go away. But the minute I ramped up activity, the pain would come right back. It wasn't until I started doing targeted strength training, neuromuscular re-education, some exercise can help improve my form. I was able to avoid surgery, and I was back to running in 6 weeks, right? Like at full speed too, not just doing very slow jogs. So then the second thing I like to ask is, hey, what makes it worse, right? Oftentimes when I'm working with runners as a physical therapist, I'm asking, hey, what makes it worse? Because we understand the pain behavior. In addition to the location, we can understand what type of pain you're dealing with. So is it just pain with bending your knee, right? Bending and straightening, so knee extension, knee flexion. Now, if it's just with knee extension, it might be quadriceps tendonitis. But if it's primarily with knee flexion, it might be hamstring, right? Pain in the back of the knee. That's aggravated with flexion activities like hamstring curls or walking, but you keep feeling it, or even cycling the back of the knee. That's hamstring tendonitis. Could be, again, it's not 100%. Again, it's always best to work with a medical trained professional like physical therapist, but I'm giving you a general guideline here. How about pain that's worse after sitting for a long time? Maybe you sit for an hour or so, you get this morning stiffness as soon as you get out of bed, your knee's really stiff and achy. It doesn't want to move. It's likely arthritis, usually common in runners over 50 years old. And the pain does get a little better with general movement. As they start moving around, it gets better. But the minute they sit down all gone, again, they're sitting for a long time, or even they're standing in one place for a long time, that knee pain comes back. So I had one of my 60-year-old clients who could barely jog for like 5 minutes or so without, that knee arthritis pain kicking in. And then it wasn't until we started doing some joint specific, some knee joint mobility drills. This person first was lacking like a knee extension, we worked about knee extension mobility, and then some low load strength training work that they could do throughout the day. He was able to run a half marathon in under 2 hours and 30 minutes at 62 years old. So it's possible, even with arthritis, to get back to running. You don't have to think that arthritis is, oh, I have to stop running altogether. Because many times people think with arthritis that you have to give up running altogether. That's not necessarily the case. How about if you're dealing with pain anytime your foot like hits the ground with impact, with like running, jumping, weight bearing, and even at night, and then maybe it gets worse at night? This might be a red flag. You might be dealing with a stress fracture. It might be a stress fracture of the femur or the tibia. So the femur is that long bone that connects to your knee from the top of the thigh bone, and then the shin bone, that long bone is the tibia. So you may be dealing with a stress fracture there. And you should stop running, especially your severe pain that you can't even barely walk. You're limping. Go get checked out. Go to a doctor, right? Especially if it's persisting there for like 2 weeks or more, and you're in severe pain. You could barely walk. Severe swelling. Go to a doctor. Get it checked out. That's going to need some imaging. That's going to need consulting with a medical professional. Don't guess, because there's not a foam roller and pray and hope that's going to get better, because it actually may get worse and could turn into a full-on fracture, where you may need to even get a surgery if it's really bad. So get this checked out. So what other symptoms do you feel? So I always ask, hey, what other symptoms do you feel? Are you also feeling back pain? Are you feeling burning, numbness, and tingling? Because the thing is, oftentimes with knee pain, it can actually be coming from the back. About 25% of knee pain is actually back or spinal related. It could be a pinched nerve, right? If you're feeling burning, numbness, and tingling along the knee, and it's traveling up the knee into the hip or the back, that actually, again, might be coming from the back, and it's not knee pain. A lot of times people think they're dealing with a knee issue when it's actually coming from the back, and they're doing foam rolling and knee stretches, and nothing's happening because this whole time it was a back issue. For example, I had a runner come in thinking she had IT band pain. Turns out her issue was spinal. Since I'm a McKenzie-trained physical therapist, I did a McKenzie assessment and then gave her some treatments based on the McKenzie method. And her knee pain, what she thought was knee pain, was actually coming from the back, was gone in just 3 sessions, right? That was a little around 2 weeks. She was surprised how rapidly it was resolved, because in this case, her knee was actually coming from the back. Another thing is, how do your symptoms feel? Do you feel unstable, like your knee might give out? So it could be a ligament issue, right? Or it could also be meniscus involvement too, right? If your knee feels unstable, like you're walking, or all of a sudden your knee kind of gives or buckles underneath you, you could be dealing with like a ligament injury, LCL, ACL, MCL. Again, if it's very severe, chances are you probably notice, because you'd hardly be able to walk and you'd have to go to the emergency room. But if it's more mild, it would just periodically kind of buckle or give on you. Again, the knee may feel unstable. And then you may just have to do strengthening exercise for the tissues around the knee and the hip to help the knee stay stable. And again, if you're unsure, we'll work with a physical therapist. Is the pain worse at the same time every time you run? Like you don't feel any pain during walking. It's only during running, and only at a certain speed. Like you could go very slow, you could jog, you don't feel it, but you only feel it at a certain speed, like when you start going to faster speeds. This might be an issue at load tolerance, right? Your knee is not able to accept the load, the impact loading of running, because again, running could be 2 to 3 times your body weight. So if you're like a 100-pound runner, that's 200 to 300 pounds of force going through your leg every time your foot hits the ground. So then the key is managing your volume and your mechanics, making sure you're gradually ramping up your running, right? So maybe you're running at a speed that's just too much for your body. So start slow, do the 80-20 method, 80% easy, 20% hard, and then also do strength training 2 to 3 times a week to fully strengthen your leg so it's able to handle the loading, the impact loading of running. So now that you've learned how to spot the root cause of your knee pain, don't keep guessing or following a random advice you find even on YouTube, right? And if you're still feeling stuck, go watch my free training video where I break down exactly what to do to help you run pain-free. Link in the description.